right, we are ready to get started. I hope you enjoyed your snacks. Our next speaker is our registered nurse and elder care coordinator, Ina Golden. Ina began her career by serving as a hospital corpsman in the U.S. Navy during the Vietnam War, and throughout her nursing career, she has worked in critical care, pediatrics, emergency department, and medical services, quality improvement and research, and nursing education. We've personally witnessed Ina save many of our clients' lives with her advocacy and assistance, and we're very happy to have her speaking with us today. Please help me welcome Ina Golden.
Thanks. It's nice to talk to you all again. And I'm so happy that after my last talk, I had so many people come up and talk with me. And if I couldn't answer your questions, we went right over there, and hopefully the guys helped you out some too. So we're going to talk about substance abuse in the elderly. And what an interesting topic it was when I was looking it all over. So what are we going to discuss? And what I do this for is when I was taking a class on how to teach, it was tell them what you're going to do it, and then tell them what you did. So anyway, I'm just trying to follow along with that. So I'm going to talk about, is it a problem? Alcohol dependence and abuse, and some of the side effects in early and late onset. Then I'll go into prescription drug abuse and illicit drug abuse and treatment and follow-up, and then some problems sometimes that they have with end-of-life care. This is our client, not really our client, and we'll call her Gladys, not her real name, but anyway, I'm going to tell you a little story about Gladys along the way. We worked with a family. The middle-aged children approached us because Mom was living alone, and her drinking had been more than usual since her husband died. The children had come in to see if they could get some paperwork for Mom. She had early signs of dementia, and they were worried about her mental condition and her safety. They told us that she lashed out, had wild mood swings, would sometimes sleep for days, and was neglecting her hygiene. And when questioned how she spent her days, she couldn't remember. The rest of the story comes later. So, is it a problem? Well, alcohol is the #1 substance abused by the elderly, followed by opioids like codeine, hydromorphone, Lortab, Norco, Vicodin, Oxycontin, Morphone, Percocet, and others. And then #3 are prescribed drugs with potential abuse, such as those for anxiety and pain and insomnia. So how did this all happen? I'm going to give you a little history lesson, and yeah, it goes back a little bit to the military. It all started after World War II, when the soldiers and sailors came home. They had been gone for a long time, and finally they got a chance to marry their sweethearts, and they started having babies, and babies, and babies. And that became the baby boomers. There was a boom in the population. The numbers are from 1946 to 1962. It's called the baby boom generation, and I'm one of those. When us boomers became teenagers and young adults, we were confronted with huge social change. Some of you are way too young, but some of you lived through the 60s. Those 60s were pretty interesting with a whole lot of social change. Women's lib and civil rights, and the pill, and the controversial Vietnam War, and the draft, and oh my goodness, that rock and roll, that alternative stuff. We were rebels, and it was a perfect storm for a culture change that was sex, drugs, and rock and roll. And I don't know how many else remember here that the big mantra was, don't trust anyone over 30. What? Those are kids. Anyway, by 2030, there'll be 72 million Americans older than 65. And this statistic blew me away. 10,000 baby boomers are retiring every day. Every day. But some never grew up. So let's talk about us baby boomers as seniors. Well, we're living a lot longer than our parents and our grandparents. Why? Medical advances in life expectancy. And I can tell you from being an ER nurse and all, and also EMS, that, well, back in the old days, Grandma or Grandpa would have a heart attack and, well, they passed away because they had a heart attack. Now, somebody has chest pain, they call 911, ambulance gets there, hooks them up to an EKG. By satellite, they transfer it to the hospital's ER sees that they're having a heart attack. They alert the cath lab, EMS gets there, they zoom them up to the cath lab, open that heart artery, put a stent in it, and sometimes they're home the next day. And I bet you know some people who have had more than one heart attack, or 2 heart attacks, or 3 heart attacks. These people 50 years ago would have not lived that long. Alcohol use disorder or alcoholism has more than doubled in a decade. We're living longer and sometimes not as healthier. And they predict that there will be 1 in 6 people over 65 that will have problems with alcohol. That's huge. There's also a misuse of prescription drugs, and I'll go into that later, but that has increased by more than 100%. Again, because we're living longer, but I think it also is because of big pharma and advertising. And then another problem is mixing alcohol and prescription drugs. Well, the medical system is ill-prepared for the older substance abuser. Gerontologists are in short supply, and physicians, when they go to medical school, they don't have a whole lot of training in elderly substance abuse. And if you look around, there are few treatment programs that are just for the elderly and substance abuse. I think there'll be more, because if you think of it now, we have some senior ERs and we have senior things going on. Eventually, hopefully, there will be some senior treatment facilities as well. Now, next picture I really like. This sweet little lady grew her plant and won a blue ribbon in the county fair. So people over 50 were interviewed about cannabis, and 4.6 million people said, yep, I've taken it. Medical marijuana is legal in 31 states, and recreational marijuana is legal in 10, including Michigan. The CBD, or the non-hallucinogenic component to it, if it's made out of hemp, is legal and you can use it. It's used for epilepsy and vomiting following chemotherapy and increase in appetite. And also, I went to a conference and I listened to a pharmacist from Minnesota. And in Minnesota, you have to have a pharmacist dispense marijuana or cannabis. And she calls it cannabis all the time. That's its Latin name. And she said they have seen a great improvement in quality of life for those that have the agitation of Alzheimer's when you give CBD and a little of a THC. And she talked about how she dispenses it and how she looks at it. And it's not like you need this one and this one. Sometimes you have to experiment a little bit for that. But it was really interesting how the cannabis can help with that and help with the quality of life. However, it can be psychologically addicting. So how come are we having all these problems with substances? I told you we're living longer, but the bottom line is age. And fat stores, we have more fat stores, which decreases body water, and so it doesn't take as much to get somebody drunk as it did before. Their liver is slowing down and the circulation is not as well. And if they've been an alcoholic for a long time, they usually have some liver problems. And then, as you know, a lot of medications are detoxified in the liver, like blood thinners and anticonvulsants as well. And things slow down, so things can accumulate in the body more too. With the immune system, it is suppressed for people who have alcoholism, or what is it called, the condition of alcohol. There's a social work name for it. I can't remember right now. But alcohol use disorder, thank you. And when I talked about the immune system and not having as great of an immune system, did you know that the largest growing segment population of HIV, or human immunodeficiency virus, is in the elderly? It is. How come? Big Pharma with Viagra, Levitra, and Cialis. There's some neuro changes too. Blood supply is decreased by 20%, and the brain shrinks, and there's vitamin deficiencies. And 23% of psych patients in nursing homes have had alcohol use disorder. Our bodies are wearing out when we get older. So imagine you have somebody who's making an appointment to go to a new doctor because the one that they've used for years is not in their system with their insurance anymore. And one of the very first things you do when you go to a doctor is fill out all those forms. I just went for my yearly check. I had to fill out 3 sets of forms, one for the hospital, one for the doctor, and one for Medicare. And there's all these questions that they ask you. And so imagine that a person goes to their doctor and they're sitting in the doctor's office, and the history part of the exam, they say yes to several of these questions. Are you having memory problems or changing in sleep and unexplained bruises? Are you irritable or restless or depressed? Do you have an unsteady gait, frequent falls? And all of those were on my forms. Unexplained chronic pain, changes in eating, wanting to be left alone, failing to bathe or keep clean, losing touch with loved ones, and lack of interest in activities. So here's the new doc that sees this and sees the person for the first time. What do you think their take is on all of that? So what is the differentials, or what the doctors have called rule-out diagnoses? Physicians, again, have little training in addiction and very little training in geriatric and substance abuse training, and some of them don't think that women, elderly women, can be alcoholic. So here's some of the things that it's hard to recognize that might be running through the doctor's head. Is this a new disease? Is it part of the aging process? Could it be Parkinson's, and people really have a lot of problems on Parkinson's if they're giving an anti-psych drug? Is it confusion or depression? Oh, they're old, these symptoms are expected. Maybe the person did not record their drug or alcohol history correctly. I can tell you, as an ER nurse, we were told when we'd ask somebody, so how much do you drink? Double it. And usually when they say I have 1, it's a 40-ouncer. And some patients lie about it. Relatives may deny the problem if the relative brings them in because they want to safeguard the family reputation and not let people know that they may have somebody with alcoholism in their family. Sometimes it's difficult to take history on a confused patient. And some of them, when you say, how much do you drink? I don't know. But yet, if you go into their homes, you can see all of the empty bottles and things. Again, there's very little education for physicians and social workers, but not you all, because you have been educated that this is a serious problem, and there's a lot of people that have this. So let's talk just a little bit about alcohol dependence and abuse. By 2020, how many what is it, 7 months away? 6 million seniors will be battling alcohol abuse. And again, lower amounts have greater effects. So sometimes people rationalize why they're drinking so much. And this cartoon on the left says, my doctor said only 1 glass of alcohol a day. I can live with that. A little bit big, isn't it? Okay, back to Gladys. She lived alone, and then she started not answering her phone when the family called, and the police were called for a welfare check. And I got to give police a lot of credit, because they have no idea when they go into these apartments what they might see, or these homes. Anyway, the policeman went there, the family went with them and said, you go check on her. And the policeman went in, and he found Gladys. She was okay, except her place was a mess, and so was she. And then the family looked at the police officer and said, you've got to do something. This is just not right for our mother. Do something. And the police officer said, it's not against the law to drink yourself to death. So the family had to look elsewhere and say, now what do I do? Well, going back to alcohol, there's early onset and late onset. And I think it may have started with those early onsetters, maybe in high school, or I got to tell you, when I went to college, have you ever heard of keggers? Or then on the weekends at college, what they do and having their frat parties and different things, and they get used to the alcohol. And they, you know, even though they have the MIP or minor in possession, sometimes they get away with that. But the early onset, they start drinking a lot in their 20s and 30s, and then it's a lifelong pattern where on the weekends they drink a lot, or maybe throughout the week. 2/3 of elderly alcoholics are the early onset ones. And it's more difficult to detox those with the lifelong drinking habit. For those with the later onset, how come that started? It's usually with some stressful life event. It could be the death of a child or a spouse or a friend or a pet or somebody or a family member. It could be retirement, and they start drinking because they're grieving their last job. Could be loss of income. Maybe they relocated. It's like, we're leaving here, we're packing up, and we're moving to Florida, and it wasn't exactly what they expected. And I got to tell you, older men, they are set in their ways. I know I've been married 45 years, and they don't like to change. So sometimes big changes can have some big problems. Family conflict and then some mental and physical decline also can have them drinking. So with Gladys, it was the death of her husband of 50 years, and she was grieving, and alcohol made her feel better. So what are some of the barriers to treatment? Family says, Mom's old, what difference does it make? Go ahead, just let her drink. Or Grandpa has nothing better to do. If he enjoys it, okay. And then some want to hide the family secret. And then some people who drink alcohol a lot are real good at hiding it from family and friends as well. So those are some of the barriers. I'll get later on into how we can help with this. So talking about prescription drug abuse, several seniors have had one or more of these conditions, and I bet you know some. A knee replacement, a hip replacement, either elective or after a fall, gallbladder surgery, or other painful conditions, and their doctor gives them pain pills. And sometimes even after 5 days, they can become addicted. What was interesting that I learned is that, you know, there's a lot of like young and middle teens that have their wisdom teeth removed. There's a huge push now for dentists to not give a whole lot of opioids because that's how young kids can get addicted. And whenever I've had surgery, orthopedic surgery or something, you get the big bottle of the narcs. Now they're doing it a lot less so that you don't have as much. But the people start taking the pills and they may get addicted, and they say, I need another prescription, doc, and the doctor says, I'm sorry, by law I can't give you any more, try this, this, or this. But they're addicted to the medicines, and so what do? They start going into the ERs, and they're seeking drugs, and they say, I have this painful condition, I need something, my doctor won't write it for me. Well, the ER docs are getting real careful at that. Some of them are pretty creative, and they'll call their dentist on the weekend and say, I've got this horrible tooth, I need something just to get me through so I can see you the next time you're open. And dentists are getting wise to that too now and maybe not writing those prescriptions. Sometimes they'll beg their friends. I know you have some extra pills from your surgery that you didn't use. Why don't you give them to me? I have a lot of pain. And then others resort to going on the street and buying them too. So what is the problem with the addiction and how can we treat it? They're looking at that part of the brain that's causing addictions, but they haven't come up with any treatment yet that I know of. 40 to 60% of the addictions are genetic, which is really hard to fight when that happens. So how does it happen? Well, it starts innocently, taking a little more than prescribed, and sometimes chasing that with alcohol. But with some people, their pain is untreated or undertreated, so they want the pain gone, and they take a little more and a little more. And then sometimes they can't get to sleep, so they need sleeping pills. Or they're anxious, and so they get on anti-anxiety meds. And then chase that with alcohol as well. And then they can't take their medicine unless they have alcohol, and that causes some problems as well. I like this picture because that lady on the front, she just looks at all those pills and says, now what? So here are some of the pills that can cause some problems. Barbiturates such as Nembutal and Seconal, benzodiazepines like Xanax and Valium, Ativan, Klonopin, and Restorol. I bet you've seen prescriptions for those in your places. Ambien, Lunesta, and Sonata, sleeping meds, and those seniors have a lot of problems with and can become addicted to. And I already talked about the opioids. Amphetamines such as Adderall and dextroamphetamine for like narcolepsy. ADHD meds, cough medicines, over-the-counter ones, and sometimes you have to sign for them, but you can go to different pharmacies and sign as well. Dextromethorphan and pseudoephedrine. And these, a lot of times, are the drugs that are abused. So what are some warning signs that you see that it could be somebody's abusing drugs? Well, they have increased drug tolerance, and so they take more and more. They use drugs to avoid or relieve withdrawal symptoms. They can't control their drug use, and their life revolves around when can I get my next fix or when can I get my next pill. And so they stop seeing people, they stop enjoying and going to activities, even though it's negative type things. Sometimes they're fearful and anxious and paranoid. And they may be really, really energetic at one time and then really, really sleep for a long time and then have wild mood swings. And sometimes unexplained personality changes. And if you're on the opioids, to me it would be really a detriment to the quality of life because of the horrible constipation that it causes. And they can avoid social activity because of that. Speaking of opioids, let's talk a little bit about that. And who wouldn't want to avoid some of these symptoms that people have who are addicted to the opioids? Confusion, depression, delirium, insomnia, Parkinson-like symptoms, weakness, loss of appetite, change in speech, loss of motivation, memory loss, family and marital discord, they're seeking drugs, they're doctor shopping, and constipation. So genetically, some people are predisposed for it, but it sure is an awful thing to get into. Then, with illicit substance abuse, it is a growing problem with the elderly. I know one gal took exception to this. The young elders are 50 to 64. AARP sends your first card out when you're 50, and I had one sent over and over and over, and I thought, did they think my near memory was gone? Is that why they kept sending me ones? Then I found out it's different companies that send them to you. But that was back when I was a young elder. Anyway, with the young elderly, they show a greater preference to cocaine and heroin, and the older ones, cocaine and marijuana. But now marijuana, recreational marijuana, is legal here in Michigan. And I mentioned to you also about the CBD and how that can help. I was at a place yesterday, and they were talking about how CBD helps with their muscles and how with their knees, and just a little bit of CBD oil in like a lotion, they can rub it on their knees and it feels a lot better. And so I was the biggest naysayer on marijuana and cannabis until I went to this conference, and now I see that it can really help people. It's the cannabidiol, and that CBD oil was by the U.S. Farm Bill in Michigan. It was signed, and it took effect January 2019 for this CBD. So I talked to you a little bit about interventions for drug and alcohol abuse for seniors and what can we do. Well, it's usually the family or the caregivers that recognize this and say, something's not right, and then they make the decision, we're going to have to help this person. But how can we help it? Well, they can make an intervention. And a lot of times it's best to have a support specialist, somebody who's gone through this before, somebody who knows how to talk with the person and how to arrange for this big meeting, and also somebody that has an association with a geriatric care place that can help with detoxing and help with the treatment. And so with Gladys, her family talked and decided it was time for an intervention. If she agreed, they wanted her to go to a program for geriatric substance abusers. So they found an interventionalist, and the interventionalist talked to the family almost as if it was a play. And they said, okay, we're gonna go to the house. This is what I'm gonna say. This is what I want you to say, and I want you to be real heartfelt to tell your mother and your grandmother how it feels when you don't have a chance to see her, and how she's staying in the house all the time, and how you feel sad that she's grieving. And so that's what happened. They had this intervention. And it was a great deal of emotion, and each family member explained how it affected them. And the interventionalist had it all prearranged for Gladys. And so after seeing how it hurt her family, she said, okay, I'll go. And the interventionalist took her to a place for geriatric substance abusers. It was 100 miles away because there's not that many around. And she was taken to this beautiful center in the country for a 30-day residential stay. So there's very few programs that are age-specific, but I know that we are having more and more senior housing, but I think we're going to be needing more and more senior substance abuse programs, and we need those just specifically, so you don't put the 20-year-old in with the 70-year-old, because there's a lot of differences in it. It's hard to have senior abuse programs because you have to have special diets for those that are residential, and you also have to have special medications and to watch out for the comorbid conditions that they have. What also is hugely important is the aftercare programs. After they've gone to the substance abuse treatment and detox, to get right into AA or Narcotics Anonymous, NA, because lack of social support will really cause them to not have great success in it. And sometimes that's really hard because sometimes they've shut out family and friends for so long that the families aren't there as much. So with rehab, detox symptoms they peak in 24 to 72 hours. Maybe you've heard about alcoholics that have the DTs. This is not the time for seniors to do it on their own. They can die. They can have heart arrhythmias and die. Also, it is not the time if somebody says, hey, I have some Antabuse, go ahead and take that. And Antabuse is a medication that after you've been detoxed and you're not having alcohol, you take it every day, and if you're around and you drink alcohol, makes you deathly, deathly sick. I've seen it in the ER, it's horrible. Not for seniors, can kill them. So that is not the way to go about this either. But there's different treatments. I told you about the inpatient, there's outpatient, and then there's a waiting list, especially for the geriatric programs. And what do you think they're doing while they're waiting? They're not detoxing, they're keeping up with their medications as well. Now here's another problem when you have the young guys with the old guys or young gals with the old gals in treatment programs. They bond a lot. They go into treatment and the psychologists talk with them or the social workers talk with them and get to the nitty-gritty and the core of why are you drinking. And so these old guys talk to the young guys and they bond even after they get out of the program. And sometimes the young guys relapse and they get the old guys to relapse too. And then I've also heard that at some AA programs, they have some not so nice guys right outside the doors that say, hey, I've got something here for you. Here, give me some money and I'll give this to you. So it's real easy to relapse as well. And so that's why it's good to have just the geriatric programs there too. It's important to have those support groups too for this substance abuse therapy. So I was looking for treatment for elderly alcohol drug rehab. In the whole state, most of them are up north around Traverse City. There's some down here, but most of them are way up north for the elderly for the substance abuse treatment. And again, when I was telling you about Gladys, not our real patient, not the real rehab either. Whoops, back here. Okay. Again, the follow-up treatment is really imperative with the Alcoholics Anonymous, Narcotics Anonymous, there's Al-Anon and Alateen, and a new program that I hadn't heard about was ACOA, which is adult children of alcoholics to have support programs as well. So I told you about the rest of the story with Gladys. So she loved her family and didn't want to disappoint them because of the pain that it was causing them. And in the 30-day residential center, she went to a lot of, she talked about the grief and the loss of her husband, and she understood how it was easy living all by herself in that apartment for her to drink more and more, and she learned ways to stay on track. And she looked forward to going to AA, and her family was very supportive of her. And the family convinced her to move out of her house where she was all by herself, and she moved into a senior apartment closer to them. And she was really surprised to see that this senior apartment complex had an AA group that was there once a week. And she, her outlook improved, and she enjoyed seeing her children and grandchildren often. Well, again, her outcome is better than most, and sometimes it takes more than 1 or 2 or 3 or 4 times for detox to attain sobriety. Now, I talked to you that I would mention about end of life with those that are addicted, and a lot of times these people are in hospice and they may be dying at home. It takes more medication to get them out of pain. But one of the big problems is, what if someone in the family is also addicted? They may be wanting to take the medication of that person that needs it, who's dying. So it needs to be really watched carefully. And again, it's a huge, big problem with the family. It's a family systems theory where you look at the different parts and put it all together as a whole, because there's a lot of tension and anxiety, and then a lot of shame and guilt, like if I had only taken her earlier for detox, maybe this wouldn't have happened. And it takes a lot of help and emotional and spiritual support for the family and also the person who's dying. And again, they may need a lot more doses of medication to help them as they're going, and they may look back on their life and maybe regret it as well. Well, enough of this sad stuff, but know that Gladys had a good outcome. So in summary, the numbers of older Americans seeking substance abuse is expected to triple. 1.7 million to 4.4 million because of all of us boomers with that big age boom. Detox treatment to me needs to be elderly sensitive and include comorbidities. And we need to have more elderly treatment facilities, and follow-up care and support is especially helpful and needful for them. And that's all I have. Thank you.